We want to bring the best of the clinical world together with the best of the culinary world, to respect that we are all both consumers and patients during different parts of our life. And for those suffering with chronic disease at different moments during every single day of our life. Well, good afternoon and congrats to all of my fellow entrepreneurs. It's quite a bunch, so thank you very much for including me. I'm really proud to be a part of the StartUpHealth portfolio at Epicured. For us as healthcare leaders, we all know instinctively, and we now know scientifically, that food needs to play a larger role in our approach to population health. Food is an incredible preventative tool for sure, but it is also a clinically proven tool to combat chronic disease and complex care situations. When following these medically tailored diets, they're hard to comply with. They're complex, they're esoteric, and it's trying to access in a consumer world that we're not typically used to dealing with. And so the challenges are myriad. Chronic disease is managed on an outpatient basis. The diets are hard. And typically the quality of the experience isn't there. It just simply doesn't taste good. And for us to bring that consumer experience to life, to really tackle those challenges, is why we created Epicured. We want to bring the best of the clinical world together with the best of the culinary world, to respect that we are all both consumers and patients during different parts of our life. And for those suffering with chronic disease, at different moments during every single day of our life. We design menus to meet clinical guidelines. We make the food easy for the consumer to get, and we make sure the food tastes incredible. When we launched with a direct-to-consumer approach several years ago and a self-pay model, we created a virtuous cycle centered on healthcare consumers. For clinicians, it is as simple as giving a patient our website or call center number. For our patients, it's as simple as ordering takeout. And for us, we get the honor to be a part of a patient's life every day in their homes, in their refrigerators, and around their dining room tables. The market between healthcare and food is immense. They're two of the largest and most fundamental industries on earth, and we're really excited to bring them back together and align them. Hippocrates said thousands of years ago, let food be thy medicine. I think with all of this, we can now make it a complement to all the other wonderful scientific advances our industry has provided. We've ramped up to nearly 1,300 patients a week focused on digestive disorders. We deliver throughout the 48 lower states, and we're publishing our first clinical study demonstrating our incredible ability to eliminate the symptoms of IBS within 14 days. The scalability of the model is very, very readily achievable. Looking at 16,000 patients at an addressable market of 10 million, 80 million, 88 million, or 200 million. There's plenty of opportunity to do good and do well. And we're positioned to partner with providers and patients to manage chronic disease, integrate into post-discharge care plans, and fulfill on consumer hopes, wants, and dreams, and population health goals. Our traction to date, there's no forecast here. They're only actuals. We're approaching break even, and we continue to ramp up at a very pace at which we're proud of and which we control. Our customer acquisition cost pays back within less than 3 orders. Our LTV, which is lifetime value to customer acquisition costs, drives nearly a 6x return on capital. And we have a high velocity of revenue where LTV is realized within roughly 80% in the first 100 days. Our partnerships span the country and span different aspects of healthcare. First and foremost, our clinical referrals who send their patients and trust their patients to us continues to grow week over week. We're publishing and committed to doing more and more clinical research. That's with Michigan Medicine, Beth Israel Deaconess, MedStar, and others. We're developing new products and therapeutic menus, whether that be the IBD flare-up menu with Mount Sinai, or an EPI menu this past year with AbbVie to help with their drug Creon and disease state awareness around exocrine pancreatic insufficiency. And at the same time, whether we deliver to your home or you need to get us on the go, we continue to find new touch points and create access points for care in distributing our product in places our consumers can reach it. We're proud that we've been acknowledged for our mission, our quality, and our experience by many media outlets around the country over the years. Most recently, we were named America's Best Gluten-Free Service in 2021, something that our company and our board is very proud of. Importantly, our relationships are core to our strategy. It is who we are. And so therefore, the data we collect to support and enhance these relationships is core to our growth strategy going forward to improve health outcomes, measurably lower costs, deepen our relationships with patients and clinicians alike, and advance clinical research as efficiently and as effectively as possible. The team comes from healthcare operations, consumer branding, technology, and food. Jamie Hawk on the call today leads our clinical partnerships and growth strategies throughout healthcare and is even a former team member at StartUpHealth. Danny Chavez Bello, our chief culinary officer, is the former R&D chef throughout Boulet's restaurant empire. And before that, he ran R&D for the #1 restaurant in the world, El Bulli in Spain. He founded the Chef and the Doctor series here in New York City and has worked throughout Wegmans and other aspects of the food industry. We have incredible board members. I believe Michael's on the call today, an incredible leader in healthcare technology over the past several decades. We're raising a Series B round of $10 million, looking to scale our technology, expand our clinical referral network and patient acquisition strategies, mature our manufacturing infrastructure, and continue to throw fuel on the fire for our growth. In addition to the Series B, I would always be remiss to say that we're always looking for partnerships. Right now, we're looking to co-develop our next therapeutic menu, whether that's in the chronic kidney disease and renal space, or in diabetes or heart disease, or in mental health around post-discharge planning. Our platform is designed and created to partner with healthcare leaders around the country and around the globe to help with new types of interventions to bend the curve, both up on health outcomes and down on costs. And with that, I look forward to your questions, our discussion, and next steps. So right now we're technically B2B2C. Most of our referrals come from clinicians and healthcare partnerships who trust their patients to our care. The DTC aspect of that model is that we swipe Visa, MasterCard, American Express cards on Epicured.com. We're not currently reimbursable, but we want to increase our accessibility through payer partnerships and other program design going forward. But today, DTC, people build their own menu on Epicured.com. So whether you want 1 meal a week with us or 21 meals, or you want to feed the family, we just took a 75 meal order yesterday being shipped to a family in Maryland. So we continue to deepen those relationships. So we started as a subscription model business. Our subscription stats for against any publicly available data, it far exceeds it. We usually have twice the average order value, 36 to 50% higher retention rates in the first 6 months. And like I said, a great velocity up front because folks are coming to us for a need, not necessarily a want. So we don't have the same fickle nature of different fad diets. And then we also question from a mission standpoint, subscription was just the way we started. The biggest reason we have cancellations is because they don't want a subscription. They want to order when they want to order, right? And sometimes the patient feels better or they figure out the diet doesn't work for them and moves on. So we don't see that as a failure. We see that as a success or a part of the journey. And certainly as post-discharge planning happens and other things, we don't want people on food forever and ever and ever. We want to get them back to normalization and liberalization. And that's a success metric of ours as well. Well, for us, what we focus on right now, our main differentiation is that we focus on digestive disorders. We cover small intestinal bacterial overgrowth, EPI, IBS, IBD. Our diets are clinically proven to work for them. There's 1 or 2 others in the country. But like I said, the TAM and the SAM is big enough for multiple competitors and people have different tastes. So we're happy and proud to lead with our brand and our quality. And that's our primary focus.